My name is Yin Mei. I believe we met most of you, or I remember most of you in a way. I hope my memory is still in a proper state at the moment. And this is very, very big groups. I counted the names on my class message. It's about 33, so it is huge. And hopefully we still can working well in the team. Now, firstly, let's have a look at the assessment, because this subject we do not have final exams due to COVID-19 issues. And let's have a look what will be assessed, what task we need to complete to complete this subject. Now, first is a literature review. Literature review and is individual assignment, which requires 2,000 words as a total, as a kind of written assessment, and choosing one of the topic within the 3 categories of Wen Bing. So we're going to talk about that later. Here just tells us one big assessment is literature review, which will require 2,000 words in total, introductions, bodies, conclusions, and not counted as references. This essay will be due, literature review will be due in week 8. At the same time, by applying the same topic or using different angle, you're also required presented 5 minutes and oral presentations or videos, and that will be due in week 10. So example, if you're choosing influenza, and as a kind of written assessment for literature review, and then you can choose specifically dietary related to influenza to make specific oral presentations and to demonstrate it in 5 minutes of videos, and then submit it on week 10. Or you can use choosing specific angles about the lifestyles adjustment during suffering influenza for the topic you're choosing, and present it in oral presentations as a video recording and submitted week 10. Is that clear? Now for literature review, thank you. There's very clear learning outcome recorded in the blackboard. So I'm not going reading individual one for you anymore. You can have a look of that required and make sure and the contents you prepared are matched to what's the requirement to achieve maximum grades. Now, because there's no more exams at the end, besides literature review and oral presentations, there's also have final case study at the end of the due on week 12. There are 2 case study has been provided from week 1 my class message, and also you can find it in the assessment 3 in the blackboard. This a kind of allocations of points for each assessment is 45 for literature review, that's a written assessment. Within the same topic from different angle is oral presentation 25. Both of these try to present different communication skills. One is from written communication skills, second is from oral and communications between you and others. So this take overall about 70%. Very, very good deal. The last, and we'll have 2 case study. This used to replace final exams. It's 30%. For each of the case study, you're required at least to write 750 words to explain the cases and utilize informations or knowledge and or formula learned from classics to construct relevant formula to deal with the conditions. So overall for this subject is 100. Okay, any questions for the assessment?
Yes, I have a question, Yin Mei. Hello.
Thank you. Hi.
In regards to the case study replacing the exam, with the 750 word limit, is that the same kind of word limit that applies for assessments? i.e. will we have marks taken off if we're over that limit or under that limit?
I think so. 751 case, that means 1,050, isn't it? 1,050 altogether for 2 case studies.
Okay, and do we have to weight the words evenly between the cases, or can it be 1,500 for...
Roughly.
Okay.
Because I believe the cases which I prepared for your guys, so let's have a look at that one. It's quite quite similar in a way. Okay, sorry. In order to complete answer your question, here have a look what topic we can choosing. Because we have 7 categories of Wen Bing. So based on wind worms, spring worms, summer heat worms, and damp worms, lurking summer heat worms, autumn dryness suffering, heat toxic related Western illness, and choosing one of the Western illness based on this category and have a literature review. Now, because Wen Bing article in English version is very, very limited. So that means for references number, maybe we only require up to maximum 6. So if you only can choose in 2 or 3, with very good, very good construction information, still be okay. Hi, Lucy.
Sorry, Yingmei, I'm getting a little bit confused. Are we talking about the lit review, or are we talking about the case studies at the end? Because I feel like that I'm wondering, are we referencing our case studies in the same way that we normally would, or are we treating?
Sorry, I just put the question about case studies on the board, and then we go through the details of a topic of literature review first for assessment 1 and 2. Yeah.
Okay. Yep.
So thank you. So I'm a little bit jump a little bit. Now, because the topic, we can choosing influenza under the windworms, or can choosing very bad acute bronchitis under the windworms, even COVID-19 under severe windworms conditions. So once they belong to this category in Wen Bing, you can choose any of this kind of Western disease. Make sure the symptoms and signs you choose can match or linked to this kind of Wen Bing conditions or categories. So by choosing each of the category, and you can complete assessment 1 and 2. For 1 is literature review, and 2 is oral presentations. Now, due to limited resources for English versions regarding the Wen Bing discussion, a lot of article has been attached in the Blackboard by Bettina in the past, are very, very good source you can have a bit read, very good article to read. Otherwise, checking online and also checking the books, which is shared by Leah in the Blackboard. Thank you, Leah, which is very, very good e-version of Wen Bing books, and you can use as kind of references as well. So any questions about choosing topic from this 7 category? Details of the disease, I'll give you a list as well. So basically, we know we are going to choose one of the Western disease and can be allocated into one of the 7 categories in Wen Bing. Yes, this is a clear topic assessment 1 and 2. Yes. Okay, good. Now, so these are details of explanations for assessment 1 and 2, etc. We can read it from the Blackboard. Now, for case study, which is due on week 12. Oh, why I put case study 2 first? Okay, this doesn't matter, 1 or 2. So this is one of the case study. You can see the basic information is quite a lot. You really need to work it out and how to regroup it and analyze the case, and then make proper differential diagnosis, give summary of the diagnosis before you provide principal treatment. So that means these 2 cases, have a look, this is 1 case, 2nd case, have similar weight in regard to information. It's impossible have one only need 40% of attention, other need 60%. It's very, very hard because these 2 are equally complicated conditions and very commonly will present in TCM clinic because they could be, say, a non-serious illness by doctors, but could be very, very unbalanced conditions, be well restored by TCM practice through herbs, acupuncture, or other therapies. This is part of answers I just replied to Elisa. I'm so bad to how to pronounce the name. Elisa.
Thank you.
Yeah, Elisa, thank you. Now, does that answer your question, Elisa?
Yes, it does. Thank you, Yingmei.
Okay, now let's have a look this kind of case briefly. Okay, I'm not go through details, just tells you a little bit directions. So this is a female, 55 years old, married without children, and she's working at a nursing home for a very high stressful position. So this age, gender, and background working environment tells you stress level very high. A woman up to this age, usually we know what kind of imbalance will occur. With detailed information, 2 days ago, the patient has been suffering from itchy and sore throat. So we know this is a quick onset illness, and from external pathogen involved. In Wen Bing, it's the wind heat involved. And the condition has been temporarily relieved after she's taking high-strength inchalsan pills. So that means the basic initial assessment is possibly matched with inchalsan can be corresponded with conditions here, wind heat or wind toxic heat. On the 3rd day, this is error, not Thursday. On the 3rd day, oh my, this is very bad. I did not find it. I checked it twice. So on the 3rd day, again, not Thursday, not Thursday. On the 3rd day, number 3rd day, she came to a clinic due to suffering severe explosive headache and chills for 3 hours. So this severe headache and chills, what that means, and is that anything linked with previous foot discomfort? You need to work it out. And she came to a clinic due to suffering severe explosive headache. So that's a concern. She coming, but as a practitioner, you need to work it out. Is headache the main issues or headache linked with possible previous throat complaint? And slightly feverish bodies for 1 hour. So something both chills and fevers presented. If you finish learning Classics 1, we know it's typical what? Taiyang conditions. But because we learned Wen Bing, we know its problem is what? In the lung systems, in the wee levels. There's no sweating or thirst. So that means what? But palpitations and waves of severe headaches, and even she's taking painkillers. For about 40 minutes, by waiting in the consultation room, her discomfort, painful throat came back to her. So that means current headaches and still related with pathogens, cause of sore throat for her 2 days ago. And this kind of suffering also accompanied with a few tiny burning blisters. Blister-like rash appears on her left cheeks. So this tells what? It's a shingles. So that's one thing I have to remind you. This actually is myself, but I changed the age, changed something else, just make it simpler. So these are typical shingles conditions, and it's typical Wen Bing conditions. Typical what? Not just a simple wind heat, something could be related with something level of damp heat. So do be aware about this as well. At the same time, the headache is getting worse, which is accompanied with loud tinnitus, very loud tinnitus, and strong pain inside of her left ear. She has a small body build and worrisome looking. Her period stopped 5 years ago, and her sleep quality is poor in general, and her appetite is average. The bowel has been inclined to loose stool. So that means they have exist what? Her urination is okay during the day and once at night. Her tongue looks swollen with dull red color. There are also teeth marks on the edge and redness on the tip and the edge. So redness on the tip and the edge. If they present as a dots, we discussed in the last term's clinical session, means congestion heat. So congestion heat, just thinking about you have dandelion growing in your backyard as a kind of weed. When you're doing the mowing, you only can chop off and top part of the green materials of a dandelion, and the root of dandelion still embedded inside of the soil. And when when there is sufficient rain and sufficient sunlight, the dandelion have very strong survivability. They are going to reburst it and from remaining of the root. So that the remaining root become congestion heat. It's similar like this. So there's some unresolved pathogen. So part of that involved in latent pathogen concept from Wen Bing study. Yellow greasy tongue coating tells a typical what? Damp heat involved. And her mouth is emitting unpleasant smell, typical damp heat. The pulse is wiry, thin, very fast, over 100 beats on the left side, and slippery, thin, rapid on the right middle positions. So go home, check the whole conditions very, very carefully. These are typical Wen Bing conditions. They may not as severe as COVID-19, but can very well addressed by using herbs and using TC treatment to deal with it. Are we okay? Now have a look. The second case, doesn't matter one or two, this is the second case. Second case is a male, 41 years old, single. The reason I make both of these cases single, make this less complicated for guys. And this one is IT consultant in the city. The patient has been suffering from loose stool on and off for over 3 years. So these are ongoing issues, post a food poisoning from overseas trips. If any of you finished Classics 1, I believe most of you, or everybody finished Classics 1, we know what formula? Wu Mei Wan, excellent. No matter what is the reason, this kind of on and off loose stool happening after food poisoning from overseas trip, always try Wu Mei Wan to start with. If they have mixed cold and heat, mixed excessive deficiency. But on top of that, the loose stool usually was worse when he drank at pubs or ate oily food. So which tells you from conventional term, he does not have a healthy gallbladder, does not have a healthy what? Pancreas. No conclusion, no conclusive diagnosis has been given from his doctors. Now, in the last 2 days, his loose stool has become watery, more frequent during the days. So when the stool becomes watery as a short-term suffering, and maybe some cold things involved, or maybe if a strong odor involved, maybe some bad food has been eaten, which is accompanied with cold intolerance and slightly nausea. So something with cold, possible cold. Chills in the morning and feverish in the afternoon. What that tells us? Is a Sao-Yang condition. So chills in the morning, feverish in the afternoon. From Classics 1, it is still called part of Sao-Yang conditions. And from the Classics 2, no, there's a possible latent pathogen has not been resolved. Something has been trapped in a Mu Yuan. There's disturbance of sleep at night from waves of hot sensations in his chest. So these are typical Wen Bing related lingering pathogen conditions. There's a reduced appetite with slightly thirst. Taste a bit of sweetness in his mouth, so indicated some spleen is not strong enough. And experience fullness in his abdomen after meal. So qi in the middle gel is also not strong. The stool looks watery yellowish 2 or 3 times daily, which can be floating in the water with 4 smells. When the poo is floating in the water, we know what pancreas does not working properly. They're not able to break down the fatty or lipids properly. That's why the poo can be floating surface, especially as lots of infants' poo is like this if we do bottle feedings. Sometimes he even feels burning sensations in his anus after frequent bowel movement. So this typical heat. And don't focus too much attention on this part. It's just very easy to shift your attention. Once the loose stool has been managed, the burning sensation will be resolved by itself. Or you can recommend some very nice bath wash locally to help to minimize these burning sensations. They are cold extremity with clammy hands. So if this comes together, we know the qi and yang is relatively weak. That's why the body fluid still leakage when they have a cold extremity. And tall, slim body build with lower spirit. So loose stool has been suffering for many, many years. All the essence, the qi body fluid will be leakage. And so that's why there's not chubby body, not overweight and skinny, slim, and also there is lower spirit. There is swollen, dull red tongue body. So we know weak spleen. Dull red tells you liver is not very happy. Some congestion heat possibly. And multiple red dots is typical latent pathogen on the tip and edge. Both emotional heart and the liver have congesting heat or latent pathogens. Numerous tiny cracks are noticeable between frontal to central part of the body. So this is a typical part corresponds to the loose stool suffering for many, many years and depleted body fluid or stomach in some way be injured. So these numerous tiny cracks only can be noticeable when patients stretch their tongue fully. If they very relax their tongue, usually these tiny cracks are not noticeable. So this is very commonly correlated in deficiency, in injury with damp heat pathogens in the middle part. Australia have typical weather, wet season and dry season. When wet season finished, during the season of dry season, you can see a lot of crack happen dry season of central part of Australia. At the same time, they have remaining of vegetations and between this kind of crack growth. So these will be typical combinations presented if they simultaneously is similar present like this kind of tongue. The tongue is also covered with light yellow color and thick greasy coating on the top. And both sides of his pulse are slippery thin, wiry, and slightly rapid. Now, do not get frustrated if you find this case is so complicated. Just slowly shade in the onion because you have 12 weeks to think it through. You don't need to think it every day, maybe 5 minutes a day for first few weeks and take more seriously when finished most of the assignment and then leave sufficient time, in the last 2 weeks to help to go through all the details, study and analyze. And then when you can achieve 50%, you find, oh my God, I'm brilliant, I'm excellent. And then by, to articulate your words and then make it much more nice in the constructions, in written languages, you can basically perform over 70, 80%, and you'll feel, oh my God, I make other people's life much better, improved in the quality. You'll feel self-proud. Okay, now any questions for these two case study or all the assessment for the subject? Do we need to reference the case study? You do need to references. This is required by the school, by all the assignment, Bridget. Thank you. Will references be in the word counting? I think everything will be counting. For later school policies, everything written in the assignment will be counted as words, yes. I'm having a problem hearing you. Okay. Has anybody have a trouble? Anybody else have hearing me? Or just because? No. Okay. Check your. Okay. So we all can hear. Okay, good. Thank you. Okay. You may, Pasuri, maybe you just logged in. Just make sure logging out again, logging in again. Maybe they can get better. Oh, you can't hear me. Something Firefox has trouble. Yeah, you can't use Firefox. Firefox is trouble for this. Chrome is better. Yeah, thank you, Lucy. Thanks, Lucy. It's great. Thank you. Okay, we recorded anyway, so if you have a trouble, you can check recordings now. Thank you. Now, if it's no more questions, let's have a look.
Yes, I have a question.
Yeah, thank you.
Sorry. Yes, some people were mentioning before, and this was my understanding too, that when we did the case studies replacing an exam for Classics 1,
Yeah.
because it was essentially us doing the case studies that we would have done in the exam, because in an exam you don't need to provide references. For
Okay.
Classics 1, we didn't need to provide references, as
Okay.
far as my understanding was, unless somebody knows something different.
Okay, we'll follow the same way then. That will be fair. We follow the same way, yes. But for the exam, will you provide a case study beforehand or only on the week 12?
No, we were provided it beforehand.
Beforehand, okay. All right.
I thought Bettina did say, I mean, obviously it just depends on the lecturer, but she did end up mentioning we should put some in text citation or like referencing if we used it, which we obviously did for some of the case studies. So
because if you only down that on exam time, no reference were available. If you do that as assignment, reference is very important for us to learn. That's the reason.
Absolutely. So for these ones, for the week 12,
because only requires 700. Okay, I'll check with the person on top of me first, and then give everybody proper answer. Is that I think it's better in a way. Have you? Okay, how did you submit your work?
Just like we did a normal case study. So there's a.
So they open another window. We haven't had the assessment 3 window open yet. Okay. All right. I'll check with them first if they required or not. I did not ask first. I did not ask permission before I released to the class. Anyway, oh my God. If they are already, okay, which week you had your case study information provided for Classics 1? Do you remember? Any of you remember? How many weeks you had that in advance?
Maybe 4.
4 weeks. Oh, that's fine. It's okay. It's all right. We give it 10 weeks. It's better. But if they only provide you on week 12, that means I need to reconstruct case study. Okay, I'll check it first. So don't do any exercise right now. It's big trouble. I should ask first. Oh my God, I did not know. Sorry, so many things changed since the corona virus comes to all of us. Maybe it's not a virus myself. Okay, all right. At least this is good cases for us to try to be able to resolve that in the future practice, because from the doctor's point of view, they just under the they are not clinically ill, but not very well balanced. For TCM, we can use a proper method to help them restore the much better balance. Now, okay, here just tells us all the details are in the blackboard. Here, I just try and remind us and go through a little bit discussion about the informations, make sure we have some idea about what will be assessed for passing the subject.
Oh, you may, before you move on.
Yeah.
Sorry. Hi, it's just Rosie. I'm just wondering if tables are good, if you're marking, if we're allowed to do tables as a format, or if you're more looking for
I
more.
think everything's available. Flowchart, tables, and the writings in proper, paragraph. They're all very, very good one. Do whatever you find is easier, convenient for you to understanding, to present yourself. That'd be all fair. That'd be good. So leave the option open anyway. Yeah, thanks.
Yeah, thank you.
So that means a lot of preparation, a lot of works at home for everybody to learn, and which does not mean you should not come into the session. But in the session, I'm not just discuss information which is available in the blackboard. I'm also will give you a bit of hint about some practical, valuable things. So if you want to know that, come in here. Otherwise, you make your own choice. So anyway, all your attendance will be automatically recorded in the blackboard. So no matter you come or not. Now let's have a look what be involved for the Classics 1. Okay, let's have a look what will be discussed for the exist information's name. Select. Okay, good. Select. Now, the original information has been very well articulated in the Blackboard, and I just, from my point of view, to try to interpret it from different angle. And maybe I have some information slightly different than what's presented in the Blackboard. If you disagree, if you have a doubt, and always good to figure out what is much better one for you to accept it, because we all have different brain, adapt something slightly differently. That's normal. So whole classics 2, we are not go through or become specialists in the Wen Bing. All of these go through very basic introductions like classics 1, like all the subject we learned so far. And if you want to be special in specific part of TCM practice in the future, you need to have further study from master's PhDs. So for this classics 2, we'll introduce the basic warm seasonal febrile disease and based on traditional Chinese medicine point of view, and discuss a little bit about the history or development about Wen Bing warm disease and what are the major scholars who are contributed for the development of the warm disease in the past. So first, let's have a look what kind of warm disease or what kind of seasonal febrile disease involved regarding the warm illness discussions. So when we people talking about the Wen Bing, all the infectious disease and serious allergies, environmental pollutions cause of autoimmune disease, and they all could be called as a kind of warm illness or can be treated as a kind of Bing theory, guided by Wen Bing theory, that goes through proper treatment. Like psoriasis for the people suffering skin disorders, they can be used as a kind of treatment. Adopted using Wen Bing series, or people have autoimmune disease cause of colitis, suffering abdominal pain, loose stool, and with bleeding. Some of the conditions also can utilize a Wen Bing series to treat it. And some serious allergies cause of skin rashes can also use Wen Bing series to treat it. And infections easy to thinking about pneumonia and very bad influenzas and hepatitis, TBs, all can using Wen Bing series to deal with it. So there's a few of the terms. I added one of the words, Wen Bing Xue. So in your words, they don't have this. Wen Bing Xue is different with Wen Bing. Wen Bing Xue, I added this, is a study of the warm disease. So Wen Bing is a warm disease. So Xue is a study or research about the warm disease. And this is one of the specific classics from TCM. So there's one of the argument which involved internal classics about yellow emperor internal classics, Sanghan Lun, Jingui Yaoli, and Wen Bing Xue. So which separate Sanghan Lun and Jingui Yaoli. This actually is one book. And never mind, they must use a different references. That's why they call these as 4 major classics. Some other people call Shen Long Ben Cao Jing is also one of the classics as well. Now, Wen Bing is very important part of concept or theories. Okay, Neijing is a yellow emperor internal classics, Charlie. Now, Wen Bing is one of the important part of classic TCM, and especially through the Ming and the Qing dynasties, through all the serious epidemic illness happening in China, especially in the southern part of China along the Yangtze River. A lot of people suffering serious fever-related conditions and also pass away due to serious infection suffering as well. So in my grandparents' generations, if you have 7 children, if 3 or 4 of them can survive around that era, and you are very, very lucky. Some of the family only left 1 or nothing. And Wen Bing is a part of TCM, so which is very important. And Wen Bing has been adopted so much in the modern infectious illness treatment. And during the SARS epidemics in China, we know around Guangdong province, a lot of TCM formula has been introduced, which are very well controlled SARS infection symptom suffering. Even during the COVID-19, these times in the Wuhan epicenter, and a lot of CM formulas, Wen Bing and the Shanghai formula as a combination introduced to help people manage symptoms as well. This kind of Wen Bing here is mainly focused on external contracted and fever as dominated warm heat conditions. So warm heat pathogen is a major causes etiologist, which can present it all year around, but for the virus specific happen in the cold season, because the virus does not have very strong surviving ability by itself. They rely on the host, like humans, animals, to survive. In the very hot weather, surface of virus structure become liquidized, and they do not have strong ability to penetrating or causing illness. But in the cold weather, the outside structure of virus becomes harder, much more easier survive for them. And also humans in the cold climate, we usually become clustered. We stay in an air-conditioned provided environment and become more dense in populations, so virus can share from one to another. That's why the COVID-19 become so aggressive in the very cold climate, cold weather as well. So do try to avoid go to the big crowds if you could in a very cold season. In Melbourne, we know cold season usually are very easy suffering very bad flu. So this is flu season right now. So do be aware, if it's possible, do not go to the crowds if it's not necessary. But Wen Bing could present it in all year around, any kind of season, especially an unstable, changeable weather, very strong wind involved. And most of the result from acute attack by the warming heat pathogens, and can present as fever as dominant conditions there. So that's why we presented warm heat pathogens. This kind of warm heat, once it affects you, is not very easy to be completely cleaned out. That's why a lot of people, when they stretch their tongue out, you can see lots of dots remaining either on the tip of the tongue or surface of the tongue around the edge. This kind of heat, some part has been translated into kind of lurking pathogens. This kind of lurking pathogens is also can be called as kind of congestion heat. Congestion heat can caused by emotional unresolved emotions or by external heat attack unresolved, which trapped in the collaterals. Dots always refer to the lurking pathogens. Yes, either lurking pathogens from the emotional constraint or lurking pathogens from external wind toxic heat attack. Yes, in some part, they call that correlated with antibodies. And like example, I mentioned about dandelion's root. So when you cut off the surface part of dandelion green leafy, the remaining root can regrow, regenerated in a suitable environment of water and sun supply. Now, any question for these slides? That's a very good question, Lucy. Thank you. Yes, Ruizhang, Nanjing is one of the classics as well. Yes. Now, Wen Bing is usually typical one is called as usually presented clinically as a quick onset. So 1 minute you look so absolutely normal, another minute you can look like so red on your lips and feel hot and feverish. So they changes very, very quickly. And most dominant conditions is high temperatures or heat. So very rapid, very quick onset, and fever as the dominant conditions. Hot pathogens as a kind of young in nature, we know they have very strong penetration ability. That's why I result very quick onset illness and present fever dominant conditions there. At the same time, heat is a young, and when they invaded in the body, could injure body's yin and fluid, resulting thirsty and very, very dry mouth, wanted to drink liquid. Because heat is so is a young, and they can also causing very quick transmissions between one level to another level. So some children after had this very bad wind heat pathogen attack 1 minute, they shows very high temperature. Second minute become convulsion or become just unconscious. So there's very quick transmissions from one level to another level. Majority of the serious wind or warm heat pathogens are contagious, epidemic, or seasonal, or pandemic, or endemic locally. So these are not very, very pleasant. If any of you have children and for the age around kindergarten age, you know they're always sharing some virus from the kindergarten from other friends and then coming home sharing to their parents. So everybody taking turn to sharing this beautiful virus together through their sneezing, through their cough. So this tells how contagious they could be. Same for this COVID-19. We all read or heard or saw from radio, and this is such serious and spreading of the virus. If any of you have a questions, have a concern, and welcome to put your notes on the chat panel. So there are 4 basic features for warm pathogen cause of illness. First, as a heat pathogens, so fever will be dominated, fever. Sometimes the fever is a lower grade fever, sometimes very high grade fever, depends your immunities of individual bodies. And this kind of fever will also correlate with rapid pulses and red lips, red tongue, as well as dried skins and possible sweating for some people if their antipathogen energy is still okay. And also correlate with rapid pulses and they feel hot at the same time. This kind of fever comes very, very quick. So some kids, when you send them to the kinder in the morning, they're still normal, jumping, talking, speaking. A few hours later, the teachers ring you, your kids is unwell, you need to pick them home. When you go to pick up your kids, you find the kids become boiling hot and does not have very good spirit from the eyes anymore. They don't want to talk, they won't do anything. They're so tired, exhausted. So that goes very, very hot and very, very quick. They're so dehydrated on the lips and very, very poor spirit also could represent at the same times. Urines get very dark, concentrated, and they have very, very redness on their whole faces. Sometimes if you cannot control the temperatures, they can get a convulsion very quick for the babies. Unique clinical characteristics for the warm pathogen illness. So again, here mentioned fever is a principal and clinical manifestations usually is above 37. So this is weird. If it's not above 37, we don't call that fever. And onset acute, the changes very, very quickly. And other heat symptoms could relate it. So dehydrated urinations, very dark yellowish, thirsty, red lips for children, very easy, red cheeks for children, very easy. For the adult, they may experience bitterness taste inside of the mouth, and they may have some unnecessary bleedings in their gums, in the nose, and some have very bad irritabilities in their mind as well. Now, warm disease or Wen Bing has been discussed about heat pathogens compared with Shanhan, that's slightly differently. Because heat pathogens very easy invigorate blood circulations and also very easy to result in permeability changes for your capillaries. So bleeding or skin eruptions or rash eruptions quite common to present it due to too much of pressure of heat inside the bloodstreams. And due to this kind of heat have co-relationship with the fire natures of the heart. So this kind of heat very easy to affect the pericardium, resulting unconsciousness or coma. And heat can result in vapor. So heat can generate internal wind as a kind of something moving, result in convulsion for children. And heat is very easy to injury and depleted body fluid and yin, result in very bad dehydrations. So supply sufficient liquid is very important. Anything you eat, any food you eat have to be and fluid-rich dishes to make bodies very easy and to maintain good blood circulations, to maintain minimum dehydration, suffer from the heat pathogens. And that's why during this COVID-19 initiated in Wuhan, a lot of patients has been encouraged to, whatever you degree or stage suffering you had, try to eat and drink, try to get sufficient liquid intaking, and this is the best way to maintain minimum the suffering of the virus. So keep your appetite, or try to cope with appetite, consuming and taking sufficient body fluid and protein-rich food, and then this can help you assisting for anti-pathogenic fighting with these kind of pathogens. Same for the children. Once they can eat, always eat. But the children is not as understandable as adult. So that's why for the children, when they go to hospital, usually give them intravenous drips. If they start a convulsion, don't eat. Very easy to choke. So when they start a convulsion, don't let them eat. But for the infant, don't force them to eat. Very easy to choke. So only encourage people to eat. They conscious able to manage, to control, can cooperating. Thank you. Unique clinical characteristics of the warm pathogens here mentioned again about progressions. And because of warm and yang and heat have very strong penetration ability, from exterior to interior, that goes very, very fast, from one level to another level with no hesitations. From mild to severe, depends your constitutions. From excessive to deficiency, and same depends on your constitution and depends on severity of pathogens. So that goes very, very quick. Treatment is very important to slow down or reverse these serious progressions for the heat pathogens. Supi congee are very, very good for any kind of fever-related suffering patient to encourage them to consume. But if they also suffer vomiting, nausea at the same time, eat small amount. So one sip and another sip to minimize nausea, vomiting, to try to giving sufficient fluid to avoiding dehydration suffering. Thank you. Now, we mentioned previously there are 7 categories of Wen Bing, and also there are basic major 7 categories of warming pathogen. So based on the name of illness, here have windworms or windworm pathogens or windworm category of illness. Springworm or springworm pathogens or springworm category of illness. Or summer heat worms or damp worms or lurking summer heat worms or autumn dryness or warm toxins. Some of these strongly linked with the nature of pathogens. Some are strongly linked with the season. Some are strongly linked with the nature of pathogens here. So we can see from these slides, we know there's a wind involved, there's a damp involved, there's dryness involved, and there's toxins involved and warm involved. So this tells us what pathogens itself regarding the common pathogens. There's also have a seasons involved, and such as spring and summer and autumn. So that means the spring, summer, autumn must have a specific correlationship with the warm pathogens in the level, because spring corresponds to the world, which is expanding and rising upwards. Summer corresponds to nature of fire, which is what? Exuberance, upwards. Autumn is descending, and this is usually linked with dryness. So this is something slightly different. It's linked with the late stages of warm disease cause of dehydration, body fluid, injury-related conditions. So from this kind of analysis, you can predict generally, compared with the spring worms, wind worms, or summer heat worms, etc., autumn dryness will become less severe conditions in the most of other warm disease comparatively. Winter, we do have windworms, but windworms present in the winter is not contribution of winter itself. It's a contribution of during the winter, sudden weather changes. So that means wind comes out from warm climate or from the region like Australia or Melbourne, we call that. If in the winter, you got wind come from desert, that's the time you are very easy getting sick, get the virus affected. So there's sudden changes from the cold weather in winter. We mentioned that previously, or you may already know, we have 4 seasons all year around. But within the last 18 days of each season, and they have something associated with the earth. Why? Because that kind of changing between one season to another season, and there's a lot of wind. Summer, spring-like warm wind will comes and blowing in the air. That could be correlated with wind warmth in the Wen Bing study. Now, here is an example of the Wen Bing related of Western name of illness, such as influenza. We know when we suffering influenza, nowadays we have vaccines. Usually it's no serious condition that will be presented unless we are very old, have other correlated basic illness, rubella, hepatitis, malaria, and pneumonia, etc. They are very common conditions and present as a fever dominant conditions, could be and discussed based on the symptoms under the category of Wen Bing in TCM. Yes, for this kind of very cold weather, if you feel wind is so nice and warm, come from northern part, north wind, this wind come from desert. They contain very unpleasant virus inside. There's a question, why has COVID-19 defined weather conditions and traveled all over the world, all season virus? Okay, now because, all right, we do know much of details of COVID-19 yet, even scientists. But based on the common knowledge, we should be able to understanding any kind of virus, if they're causing epidemic or pandemic, they have to have something else to causing this kind of serious spreading. If this is a new virus, usually they do not causing, if this virus is completely new, never existed in the world, usually you don't causing very serious pandemic like this, unless there's already some hidden previous unnoticeable inflammations or infection spreading in the population, but without showing any kind of symptoms. That's why when we go to lurking pathogen discussion, you'll find lurking pathogens cause of Wen Bing usually more severe than non-lurking pathogen cause of Wen Bing, because they already have had congestion heat, lurking pathogen internally as a kind of specific receiving form to help to get pathogens in and welcomes in and causing big disturbing inside. Yes, if they have more lurking pathogens involved and much more severe and epidemic will be involved, more severe clinical manifestations involved. And there's no, scientists has been proved it's not man-made virus. It's impossible. We don't have the skills to make that yet. It is original from the bat, but how from the bat come to the human has not had final conclusions yet. So that is scientist argument from one of the European and American scientists. But politically, they have a lot of argument. They all say it's man-made in the laboratory. Anyway, we leave these political issues there on board and leave it for scientists to answer the questions. And COVID-19, based on the clinical symptoms, is typical Wen Bing, because the fever can be dominated in one stages when the virus cause of a pneumonia comes through, or when it results in children's very bad immune overreacted. but not all of that will present fever. But once they have fever, yes, because they're epidemic and fever dominated. So if they are Wen Bing or not, based on clinical manifestations and based on the epidemic or contagious. So this is part of the Wen Bing based on clinical manifestations. Now, bird flu is another warm disease, and this is because they're very virulent and has a strong tendency to enter the Qi level very quickly. And this does not last much in the world, in the populations, but it's horribly killed quite a lot of people, and it's horribly affect the human, causing a lot of fear around Hong Kong's in southern part of China. So bird flu. And this is very simple flow chart that tells the progressions about pathogenic factors. So very quickly from exterior to interior due to heat nature. Very quickly from Wi level and transmit to Qi level, even nutritive level or blood level, or they can adapt more than 2 levels at once. And they can affect it up, middle, and the lower gel progressively, sometimes simultaneously affect both these up, middle, or middle, low. So it depends on the pathogens, strengths of pathogens, and constitution of individual bodies. Now, any question for this part 1? Let's have a look, part 2. Part 2. Why they do not respond? Why they don't respond? Okay, sorry, computer a bit slow. Okay, there's questions. I think something has happened to the files on Blackboard because I cannot open the extra reading or any document. Okay, what usually, if it happened on my computer, I turn off the computer first and reopen it, and they can be normal. So have a try for the computers. They have a little bit incompatibilities between the files and the individual computer sometimes. Correct. Okay. All right. Okay. I'm going to have a look, Lucy, now. Now here, let's have a look. Second part of file for the Wen Bing. Oh, it's fine. Okay, just a Word document. All right. Now, like we mentioned, the classifications of Wen Bing, historically, they're involved 3 ways. One is a season, and such as spring warms, autumn dryness, summer heat warms, and also involve nature pathogens, so dryness or dampness, or involved occurrence of the conditions. So these have different way to category of the Wen Bing illness. So this is basically, if you go through theoretical study, you need to spend a lot of time, but this helps understanding the season correlated pathogens as well correlated possible clinical manifestation in regarding to general suffering and the tongue nature and the pulse nature. The typical example of season-related classifications of Wen Bing. So spring warms, because spring is governed by the wind and the ward of liver. So the wind is much more dominated as kind of expanding up ground natures. So wind warms usually correspond with the spring season. Summer is very warm in nature, very exuberant of heat. So summer heat warms could present in the season of summer. But in later summer and before the season turns to complete become autumn or just early autumn, you can have a damp warmth presented as a kind of due to too much eating of the cold food in the summer, and sudden weather changes, all the heat has been dropping down, and all this kind of trapped heat in the earth comes up, resulting damp warmth suffering. Autumn is a season correlated with metal and the lung. And as kind of leaves falling, all the nutrients has been restored in rhizome root, and lots of energies descending downwards, and they usually don't have a strong spleen to distribute body fluid to the organs. Lungs become less active, invigorating, and they have a lot of dryness or involved become autumn dryness. So these are very typical one based on same as the name, as the season natures, as TCM understanding. According to the nature of pathogens, one is have a damp, one is without damp. We know what kind of season usually you experience damp, such as now, right now. Winter is so damp, isn't it? But here we're talking about without the damp, it's the spring warms, it's more, and the heat involved, they don't have much damp. When spring comes, because wind is so strong, very easy to dry out this kind of damp. And damp could correlate with toxins. Yes, they could. Now, spring warms and is not dominant by the damp in general, so does the autumn dryness. But warm toxins, in general, if it's heat dominated and they don't have a severe damp, but if heat is not dominant, they could involve with a damp. But because heat dominated, and then they are going to suffer from fever and aching and pain, become Wen Bing. If heat is not dominant, damp dominated, they are not Wen Bing at all, and they just a kind of lingering things like ulceration. They have no fever. We don't call that Wen Bing. If this answers the question, thank you. Now, for the Wen Bing that involve the damp, the typical one is summer heat warms. Second is the damp warms happening later summer, early autumn, and lurking summer heat. Lurking pathogens always involve with some level of damp. No matter this kind of lurking pathogens caused by emotional constraint over time or caused by external pathogen attack, for basic term of lurking pathogens always involve some level of damp. But for the Wen Bing lurking summer heat, is involved with a damp. Thank you. Now, duration or timing of the illness. Now, for most of the common cold, we call that newly contract an illness if they have fever, or if you had the pneumonia, if you had the influenza last year, and you had the vaccine this year, and if you suffered influenza, the symptoms were not as severe as people has not had vaccines. So this is still called that newly contract warm pathogen if the strain of influenza is different than last year. But if the strain of the influenza is exact same as last year, you are not get great beneficial in a way if you have different strain of a virus, not virus, vaccines injected. No, this be confusing. Okay. Now, in the early years, each clinic will using remaining vaccines left from last year to do vaccinations for the clients. Yes. When the new strain of vaccine has been created, and from the mid-year later, they are going to introduce new strain of vaccine for people prevented influenza. So that means if you go to flu vaccine in a very early year, you got this kind of vaccine is used to prevent influenza comes last year. So if it comes in mid-year to have influenza vaccines, and usually this kind of vaccines is new strain vaccine preventative things. You can help look out any new contract influenza vaccine, influenza virus attack to minimize clinical symptoms. But for some of the patients, once they have remaining antibody affected from previous years, and once they have newly contract the same pathogen attack, they are resulting lurking warming pathogen disease. That way, that lurking warming pathogen disease will comes out clinical symptoms will be more severe than a newly contract warm pathogen disease, because they already have exist antibody. That means they already have sufficient army to protect themselves. When they're sending enemy there, you can hear much more severe gunfire. But for the newly contracted warm pathogens, they do not have what soldiers protect themselves. When you go attacking them, there's no gunfire. They just leaking in, sneaking in, causing a little bit destructions. They have no severe gunfire. They don't cause severe damage in a way. So that's why usually for the lurking warm disease, it's more severe clinically and represent as symptoms. That's why shingles, yes, shingles, cold sores, they all related with the lurking warm pathogens, yes. They are different of the virus, different strain of virus, but they all relate with lurking pathogen in TCM. Even you had chickenpox, you still could have a shingles when you're getting older. More older, you had suffering shingles, more severe damage and severe conditions you could have. So for people in the over 40s, suffering shingles around chest, very easy correlate with heart attack. For people who have shingles above their neck, is not good for the brain, for the orifice of ears and eyes, can cause damage in some levels. Shingles is very, very horrible. No, shingles, herpes virus is very, very bad because they never left you free. They're always very friendly, attached to you forever, for the rest of life. They embedded in your ganglions. It would be less severe generally as your body has been previously exposed. Theoretically, yes. If you have antibodies, you're not supposed to have a very serious clinical manifestations. But for the Wen Bing, when they become Wen Bing, when you have lurking warming pathogens, clinically they result in more severe clinical manifestation. Unless you have no symptoms presented. Yes, thanks. Now here's the comparisons between the newly contract and the lurking warming pathogens. So here's very, very clearly indicated origins, early stage of presentations. So it is new because they don't know how to find the places. We call them newly things, like a new, everything's a new. Okay, give you an example. When kids go to the apartment store, if it's the first time, usually they're very, very well controlled by their parents because they don't know how to go. Once they have been there for a few times, they know how to find the place they really want to. So very easy getting lost. It's similar for this kind of horrible virus in Wen Bing. So that's why when lurking warming pathogen comes through, they're causing very serious damage and causing very bad clinical manifestations. So have a look at clinical manifestations. Which one is more severe? Is that this one's more severe, or is this one's more severe conditions? So newly contract pathogen in Wen Bing is only in the V level, yes? But for the lurking warming pathogen, when they affect you, they go to G level straight away with no hesitations. Because I know where's the treasure. Like a child says, I know where's the place I want to go for the apartment store. I want to play with a toy. I want to play this and that. So for the Wen Bing, basically, lurking pathogen can cause more severe destructions and go to deep level of the bodies, causing more deep level of clinical manifestations. Yes, it does depend on your constitutions. If you have very weak constitutions, and sometimes you can have very serious damage, but with no clinical symptoms. Give you an example for very old, weak people in their 70s already have existing conditions. When they have same influenza, they could have no symptoms at all, but the only things they want is to sleep until they find they have very serious pneumonia because they have nothing to fighting out at all. Yes. So it depends on constitutions and depends on pathogens. Both of that is a result of different clinical manifestations. But for typical Wen Bing, lurking warming pathogens can cause more severe lurking warming disease for Wen Bing. So lurking warming pathogen in the body is the same strain of pathogens nearly Usually they could be same, could be different. For the herpes virus, it's always same. But for the influenza, not necessarily. The strain changes always every year. Same for COVID-19 virus has been changed a lot, only within a few months. They mutated, they changed, adapt. The virus is very smart. because they cannot survive by itself. In order to survive properly, they have to change, alter, and then to be able to survive. They are not just trying to cause any trouble for you. They try to survive within your body. The thing is, our body do not allow them to survive and fighting back, causing illness, causing troubles. But if you completely surrender and be conquered by them, maybe we don't have any suffering anymore. That's the kind of funny things we're talking about. Now, there's a continuous comparison between new contracted warm disease and lurking warm disease. So you can see from the newly contracted warm heat, when they're progressive and they follow the basic level, Wei, Qi, Yin, and blood level. But for the lurking warming pathogens, from exterior to interior or from interior to exterior, or they can reverse in way because they already have something remaining internally, has not been resolved from previous attack. With trigger from external one, they become bombarded from both directions. The treatment, the newly contract always make body sweat first and get rid of superficial attack. But for lurking pathogens, we have to deal with if they still have remaining external conditions from a combination external attack and internal bursting, we need to clear both. If the only comes from internally, we need to clear the heat from Qi levels, or maybe both Qi and Yin levels. So severity, very clearly, we know which one's more severe. So these resources come from loose references. This slide tells comparison between wind worms and spring worms. They have lots of similarity. Both of these pathogens could present in the spring season. And the different things is wind worms also represent in any kind of warm season around the year, especially spring and winter. But spring worms only present in the spring. That's why I call it spring worms. Different things is you can see from this kind of comparison regarding the clinical manifestations, which one's more severe. Spring worms is more severe because the spring have specific natures, is expanding outwards and upwards, very high temperatures, very strong thirst, so straight away go to Qi level. They may involve in convulsions if the heat is so dominated, which is only present in spring. But for the wind worms, could present any kind of windy season, but especially in the spring and winter. So if they represent in spring, how can you differentiate difference between spring worms and wind worms? So this will be difference between like a common cold in the spring and influenza in the spring. Does that make sense? So common cold in the spring, usually correlated with wind worms. They are not very severe. But the influenza in the spring, and always blame that pathogen of spring worms. So that's the severity difference between common cold and influenza. We know how many human beings has been diminished from influenza suffering. And not just Spanish flu, and also last year when American population suffering very bad influenza, thousands of people's soul has been diminished. And some of them also have doubted maybe something else is involved, but doesn't matter. It's a kind of virus infections, much more severe than the common cold. Autumn dryness and wind warm and warm toxins. These two are usually not put together to compare because it's very easy to know the difference. Autumn dryness, always dried cough, like whooping coughs involved, and dried nose, dried mouth, everything's dry. They may have temperatures, but temperature never, ever high. They may have some other external contract evidence in the past, but it's never, ever become severe conditions and only dried cough as a main concern. So there's questions. I'm confused. Influenza more common. Okay, influenzas, the severity of influenza will be similar like spring worms conditions. And severity of common cold will be similar like wind worms. For both of these conditions happen in the spring, if this answers your questions. So how to differentiate difference between wind worms, pathogen cause of conditions in the spring, and compare with the spring worms pathogens cause of condition in spring. So this is, if they all happen in the spring, how we are going to compare that. Similar compare the difference between windworms cause of common cold or springworms cause of influenza in the spring. So severity different based on clinical manifestations. Thanks. It's good to ask if we are not very clear so we can help clarify the concept. Now, worm toxins usually relate with localized infections. This kind of infection is quite severe. It's not one molecules, it's not one hair, one local issue, is clustered of the infections involved of the sweating glands. They become very bad, lumpy, pasteurized, and very warming, redness, and associated with temperatures increased. So it's typical localized, very bad infections. They could have lesion ulcerations, could have everything still skin attacked and no open wound at all, but you can see very bad, horrible infections involved, very hot and painful and locally. So like mumps and scarlet fever suffering for some peoples, or they call inflammation in the gland, either gland multiple of the sweating glands or glands in any kind of part of the body, under the armpit, groin regions, or around the neck. They can happen any season around. This usually relate with some poor hygienic conditions from outside and also eating habitually from the individual persons. And here is a very, very typical images tells us what kind of conditions involve the worm disease. So when you look at these rashes, without knowing what disease, if they relate to high temperature, you know there's Wen Bing straight away. And if you know this is scarlet fever, they need to be isolated. If they happen in your clinic not able to be open to the public for quite a while. They have to be very well cleaned and then to be treated before you open to the public. Otherwise, they're very easy to share the same virus to the others. So it's good for us to able to treat these kind of patients, but if they do come to the clinic, we do need to, one is reporting to specific authority, second, you need to fill the form, and also you need to close your business and avoiding the open to the public unless you have specific isolated cubicle or room. Most of private clinic for TCM persons, they don't have isolated, very well equipped areas to deal with epidemic or infectious disease. Some heat worms usually happen in summer, and if the damp is not dominated, that means fever is more dominated. You're going to have very strong thirst, excessive sweating, and similar like a big four condition that happen straight away. If they have damp involved, you may have a chill as well as a fever, and sweating will not be dominated. At the same time, you have a lot of discomfort in your digestion regions, nausea, vomiting, poor appetite, maybe abdominal pain or diarrhea. So this corresponds to damp. It's very easy walk to the Middle Earth. For damp worms, pathogens usually present later summer or early autumn, and this could represent both of weak level conditions such as chills and fever and simultaneously presented together, but this fever usually is lower grade, and degree for aversion cold is not as severe compared with Shanghai you learned previously. Heaviness is most important, present as a kind of damp dominated, or stiffness on the chest and distension of stomachs after eating, even without eating. Greasy tongue coating is typical signs correlated with heaviness complaint for the body to indicate that dampness is dominated. And soggy and moderate pulse indicate hesitation of pulse. Cheese has been constrained due to damp pathogens. So it's all basic foundations and pathology we learned in the past. Should be simple. Now here comes new concept about the lurking pathogens. So lurking summer heat. This lurking summer heat pathogen usually present in autumn and winter. And these two seasons is kind of common to find a lurking summer heat regarding to Wen Bing related conditions. Most of people were going to present as a fever, restlessness, thirsty, and stomach discomfort, and with greasy tongue coating, and also temperatures elevated. and they can never ever settle in the one positions because they feel so uncomfortable internally and outside. They may feel thirsty at the same time, but don't have a great desire to drink, or maybe sip a little bit. The tongue usually shows very deep red tongue with scanty coating. Could look like maroon color in a way, depends the level of the heat involved. And also depends what kind of virus involved. They are going to have different clinical manifestation for lurking summer heat Wen Bing in TCMs. So this could be very, very big concept involved. But nowadays we know about herpes virus, lurking pathogen could happen any season. But if there's no fever involved, we do not call it Wen Bing, but we still can adapt using lurking pathogen these terms, or congestion heat. That's a simple way. Any questions for so far? Okay, let's have a look. Now we are going to have a break for 50 minutes and come back after break. Thank you. Now it's 9:23, come back in 15 minutes. Thank you.